If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner, and welcome to Ask the Doctor. This is the finale of our 10th season. This program was created to assist you in understanding medical issues so you can take charge of your own health. It is more important than ever to become an informed patient, and we are here to bring you timely health discussions. Remember, always consult with your primary physician. Whatever you take from this show, that's very important. Now, for those who are new to the show, there are two ways to get your questions in. One, by calling the live phone line, and second, by visiting our website at netny.net/askthedoctor. You can submit your questions and opinions via our forum. For this episode, I have Dr. Anna Saponia, internal medicine attending at New York Methodist. Then next to her is Dr. Montgomery Douglas, chair of the Department of Family and Community Medicine at New York Medical College. And then we have Dr. Soren Brenner, director of the Cardiac Catheterization Lab at New York Methodist Hospital. Welcome. I want to welcome everybody to the show. And I can't believe it's the finale of our 10th season. It's just incredible. It's flown by so quickly, but that just means we're close to our 11th season, so it's a good way to look at it. We're closer to spring, so it's good news. Now, for In the News, we have some interesting stories this week. One, can you be bored to death? I mean, everybody always says, I'm bored to death, I'm bored to death. Turns out you can be bored to death. People who are bored tend to do unhealthy things. They might eat too much, they rest too much, they have a lot of anger built up, and they found that those who described themselves as bored actually had a higher risk of heart disease and death than others. So the moral of the story is not to be bored. I don't know. Well, watch this show. I don't know. It won't kill you. We'll try and keep you entertained. Okay? Now, the other major story, I guess, that everybody is talking about was what happened to Bill Clinton. I'll put this up here. And he had an angioplasty. Now, remember, he had bypass surgery several years ago, in which the diseased vessel was bypassed using a vein from his leg. Now he came back with a new episode of chest pain, and the key is to find out where the narrowing was. And I have a picture here to show you exactly what the narrowing looks like. Now, if we could take out the In the News sign so you can see that. This is the abnormal. You see it's narrow. You see normal here, and then it becomes narrowed. You can hardly see it. And what happens is you put a catheter in, a tube, into the heart, and you open up a balloon, and it goes from this, which is all narrowed, to this. And when you have a narrowing in the heart muscle itself doesn't get as much oxygen, so you get pain. The body's amazing, right? It's telling us something's wrong, that you have pain. And you can actually go in and mechanically, with a balloon at the end of the catheter, blow up that segment of the vessel that's narrowed, and the result from this goes to this. And you feel better. And it takes about, an hour or two, and you're going home the next day. So angioplasty, while it's not for everybody, is an amazing treatment that's been developed. Now, another story while we look at that is mumps. Again, we thought we were done with mumps, and now there's 2,000 cases in New York, most of them in Brooklyn, in Williamsburg and Borough Park. Again, in two predominantly religious areas. And it's interesting, you would think, well, these people didn't have enough, they didn't get vaccinated properly. Most of these people have gotten vaccinated, but now we're finding out that the vaccine is only about 80% effective. So it's possible to still get the mumps. And where did the guy who started it go? He went to England, where many people don't get vaccinated because of false fears of problems with the vaccine. Many people were under the opinion that the vaccine can cause autism due to some studies that have totally been discredited in the last, ever since they were written. So this kid went to England, he was exposed to mumps, brought it back, and now infected. Now we have about 2,000 people. Now luckily, because everyone was vaccinated, there have not been any serious cases. So while it's not 100% effective against getting the mumps, it prevents the serious cases, and everybody is doing okay. But anybody who hasn't gotten the kids vaccinated out there, I'm sure Dr. Douglas can talk to that later, it's very important to go out and to get that done. And finally, we have a new service at our hospital in which we can do MRIs of the breast. And I think everybody out in the audience can see the lesion, except those who have in the news new MRI. Now that we got that off, is that big white thing in the middle. And what's interesting, this was somebody who had very dense breasts, and you couldn't see this on a regular mammogram. And when you do the MRI, everyone at home, I think, can see that big white tumor that's in there. So it's very important to use it in the right cases. Excuse me, it's not to replace a mammogram, but it's to aid when mammogram is difficult to read. It's also very useful in people who have cancer when you want to examine the other breast, and also people who've had surgery of the breast. It helps to distinguish surgery from recurrence of cancer. So it's something that's very important. There are very few places that have it right now, but we just got this brand new machine at our hospital, New York Methodist. Again, you can find it at other places, but I want to urge women out there to consider that, to talk about it to their doctors, with their doctors, and I think if it's used correctly, this can be a big boon to treating breast cancer and understanding breast disease. So that's our in the news segment. Now we have our quiz. This is a tough one this week, but we wanted to do a tough one going into the finale. Name an English word of more than 2 letters that both begins and ends with the letters H-E. Okay, I'm going to repeat that. An English word of more than 2 letters that begins and ends with the letter H-E. Okay? So think about that, get your thinking caps on, be the last beautiful plaque of the season to be given out. Now, we have somebody out there who I know is a little under the weather, who's going to be having a small procedure. Her daughter Mary told us about this, Angela Rowland, who's a big fan of the show. She watches it every week. I know she's watching it there. I know we all wish you well, and we want to see you get back and watching us even sooner. Watch the reruns that we're going to start showing next week. So we wish you well. Also, a particularly loyal viewer, Mark from the parking garage at New York Methodist, told me today as I left, he's having his wife tape it because he can't get home. He tried to get off the shift, and they're making it work. So, again, it's great. And then finally, Joyce Pashota, who actually lets her kids watch the show. They don't have to do their homework as long as they're watching Ask the Doctor. So I want to thank Joyce. So what we're going to do now is we're going to try and clean this mess up over here, and we're going to take a short break. And when we come back, we're going to go right to the phones. The number is 718-499-6101. You can talk about general medicine questions, symptoms from the young to the old, and cardiology procedures, such as the heart stent that I showed, such as angiograms. And I'm interested to hear what Dr. Brenner has to say. So the number to call is 718-499-6101. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. And welcome back to Ask the Doctor, where our topics are internal medicine, family medicine, and heart disease. And the number to call is 718-499-6101. I have to mention Monsignor Bennett, who made it out in the snow. I don't know, Monsignor, when are we going to get some decent weather? Monsignor says in April, so it's possible right after Easter. But thanks, Monsignor. And we're going to meet our guest before we go. Dr. Anna Saponia, who has been with us once before but made a big splash. Everybody's been asking to have you back, so it's great to have you. And I think you were out skiing.
Yes, I went to Colorado skiing trip with my family.
How often do you have to practice that skiing?
I think probably once a year it's a minimum, but as many as you can.
What about the injuries? You don't see the injuries, do you?
This is like a very big problem. So you have to know your limits, and you have to rather go slow than
That's a good advice for most
risks.
of life.
Yeah, I think this is, especially, with all these accidents we hear about, on television and everything. This is like the best advice I can give. Just go slow and know your limits.
Thank you. And we're going to have some good questions on internal medicine. I know people with blood pressure, and they want to know about salt and other issues, so we're going to get into that.
I'm ready.
Thanks. And Dr. Douglas, 2 of our guests actually postponed trips to be here tonight, which is heartwarming. Dr. Douglas, where were you? You're going to Arizona?
To Arizona tomorrow.
Beautiful. And we were talking about the Canyon Ranch and the restaurant. And we're always looking to give tips on restaurants. So maybe you could try that out.
I will.
Is it a conference or just a little
Yes, a conference, Association of Departments of Family Medicine.
Very nice. And you're in charge of the whole department, which is a major position at New York Medical College. What's the most gratifying thing about your position?
The most gratifying thing is to be able to be of service to all people, regardless of their age or their medical problem.
Yeah, you don't have to, if they come in, you can handle it. They got their baby with a sore throat, you could take care of that, an elderly person, or older person with...
regardless of the problem. Yeah, that
is nice.
I really enjoy that. It's a lot of variety, and it's, the personal, the ministry part of it, I really appreciate too.
And I know you're working on, talking about ministry, you're working on rebuilding the church still in your hometown?
Yes. In my hometown 5 years ago, we had an earthquake.
Tell them, Dominica?
In Dominica, a small island between Guadeloupe and Martinique, and in Portsmouth, Dominica, the church was destroyed by an earthquake, Catholic church, and we are raising funds, and our flyer is on the website.
We'll try and put it up on the screen too, so those who want to donate can.
Yes.
And it's great to see you.
Thank you. You too.
And of course, Dr. Brenner, who's really a world-class cardiologist, came to us from the Cleveland Clinic, which is the top of the line really in cardiology. And when did you come here? I mean, you left a prestigious place and prestigious position, and now you're in New York, which is great. But New York Methodist, what were the motivational factors?
The restaurants.
The restaurant. You see, this man, you can't get a good meal in Cleveland, right? Or actually, I had a place called Anthony's in Cleveland. You ever hear it was in a bar, a little restaurant?
Anthony? No.
Or maybe Tony's. Could be Tony's.
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 Yes,
It wasn't
Tony's.
bad, right? Yeah. I know him as Anthony. I didn't know him that well. So tell us, what do you think about Clinton's procedure?
It's not unusual or unexpected. The bypasses that are placed on the average last up to about 10 years. In fact, by about 10 years after they're placed, about 50% of the bypasses are not functional anymore. So it's not completely unexpected that there will be new disease forming in those bypasses. And in fact, his doctors really were very happy to tell us that President Clinton is very compliant with his diet and his medications and his exercise. It's really nothing that he is doing. It's the disease which progresses relentlessly, in fact. And luckily, there is something to do about it.
So does that mean that most people who go for open heart surgery or even angioplasty and stenting will need some kind of tune-up in 5 to 10 years?
It can be expected that approximately 40 to 50% of patients that have had one procedure will have another procedure in their lifespan. And even when they really follow all the instructions of their doctors and exercise and try to maintain their weight at an ideal level, and take their medications. This is not a disease that goes away. It's a disease that continues to exist and progress.
Thanks. And you postponed the trip to Israel, which is really nice. You're heading over to Israel to, I asked you to give me a lecture, you said to your parents.
No, just to visit parents, yes.
This is nice, though. Thank you for postponing it. We're glad to have you.
My pleasure.
So now we have our phone lines all lit up. We'll see who's caller number one, who's the first one of the night. Hello, who is this, please?
Madeline Mara.
Madeline Mary, again, she's almost 90% she calls in the first one. And the producers have told me you have a question about the heating that broke down in your house.
Yes.
But this is not Ask the Plumber. They're the only problem, Maddie. But we'll see what we could do.
I panicked.
What happened?
I wonder why. I don't know. I never remember me doing that. I panicked like a nut.
Okay, well, see, this show, you got everything.
Wonder what it does.
But Maddie's, yeah, it is unnerving when you start to lose heat in the house.
I know I'm 89 years old, but enough.
So how long did it take to get the heat turned back on?
What?
How long did it take you to get the heat back on?
Oh, it didn't come till today. You had to put a new engine.
But now everything is straight and you're warm? Maddie, you're all warmed up?
What? Yeah.
Very good.
Yeah.
So Maddie, we're going to miss you.
No, I was just asking, how come we react like that?
Oh,
the way I
interesting.
reacted was like a nut. I was screaming and crying.
Anna, what do you think causes this fear?
I don't know.
No, I haven't asked the doctor.
I never did that before.
What? And Maddie, I want you to listen to this answer. Why Maddie became kind of irrational. She became panicky. She's crying. What do you think?
I think, in this kind of situations, it's happened, and you have to understand that it's part of the life. And if you cannot do anything, just, take a deep breath.
I had the same reaction when I got my bill for the oil. I started panicking, crying, and screaming and everything. Yeah,
just take a deep breath, and after that, everything will take from there.
So, Maddie, keep things in perspective, and don't let it make you ill.
Yeah.
That's the key. Maddie, we're going to miss you for a few weeks, but we'll be back in May.
Okay, good luck to you.
Thanks a lot, Maddie. Be well.
Good luck, doctor.
One of the favorite callers of the show. Now, Margaret. Hi, Margaret.
Yes, how are you?
Where are you calling us from?
I'm calling from East Flatbush.
East Flatbush, yes. Where's that, near Tilden High School?
No, I'm in Kings County.
Oh, at the hospital. Near Kings County. Very nice, yeah. What can we do for you? What's your problem tonight?
Okay, my problem is I had an accident like 7 years ago. And after the accident, I had 2 surgeries on my knees. And since then, I've been developing arthritis. It's going up to my back. Lately, it's like all over my body. I'm also developing high blood pressure. It's like all kind of other symptoms.
How old are you, Margaret?
Mid-50.
Okay, I'm going to try and draw attention to these questions now. Dr. Douglas, developing arthritis, she's in her mid-50s. Any thoughts?
Well, Maddie, I'm sorry that these things are happening. This is the age where people sometimes do get sick, but then now everything seems to be happening at the same time. The fact that you had damage to the knee in the past does put you at risk, meaning makes you more likely to have arthritis, to develop arthritis, so that seems to be what's going on. And then the high blood pressure, certainly there are other things that could put you at risk for high blood pressure, your weight, salt intake, insufficient potassium intake like vegetables, stress, inadequate sleep, so many things. So now is the time you really need to focus on your health and see if these things could be, alleviated.
Dr. Brennan, do you see that at this time, like in the 50s, that people, it's a key time, it's a critical time to watch for things like heart disease, high blood pressure, things that can do you harm going into later years?
It is indeed probably the time in our lives when all the risk factors that are theoretical in our youth become real at this stage, and so it is critical that we know what they are and we modify them accordingly in order to prevent disease from progressing. And indeed, as you noted, hypertension or high blood pressure is a disease of middle age, and in fact, as you know, there are about 70 million Americans that suffer from high blood pressure, and many of them actually don't know about it. So we have plenty of treatments. It's just a matter of you getting to the doctor, and we'll take care of it.
Margaret, thanks for your call, and please call us back next season. I see now we have a suggestion. We're getting feedback as we go on the email about restaurants, and I see Luz Arroyo writes in that he likes Caravel. He says it's a real good restaurant. He says it's kosher, and you can get good Italian pastries at Michael's. There's another one, Michael's on Avenue R. And then we have Il Posto Ristorante Italiano at 7404 Avenue U. He says it's lovely and sophisticated place. Food is well, and he says everyone takes care of you. They make you feel like one of the family. And he says try the fried calamari and ask for Jeff. So if you're going to go there, ask for Jeff. It's good. Keep those coming in because we like to get the feedback on the restaurants. But now I go to excuse me, I think hello, who's this, please? Okay, I'm going to have to move on to Jane. Hi, Jane.
Hi, how you doing?
How are you? What's good tonight?
Oh, nothing really. Remember I called you up about the bloating?
Yes.
Okay. Well, I went back to the endocrinologist, and he did some hormones tests, and he said the protein level was a little elevated. So then he gave me these 2 pills to take, and I took them, and I went for a blood test yesterday. He thinks it's something with the adrenal glands.
I want to just tell the guests, Anna, that Jane has had just a general swelling of her body, as she describes, a bloating, and the doctors can't find anything. Everything.
2.5 years.
For 2.5 years. Now, I don't know what's going on with the adrenal gland, but that's where we stand right now. So what do you think the doctor's thinking of?
He thinks they have an overactive adrenal gland or it's not functioning.
Maybe like a Cushing type thing?
Yes. Yeah, the adrenals, they produce a lot of hormones, and some of them, they can be elevated and produce, some problems like you have, like obesity. In fact, there is even described one type of obesity related to adrenals, which is like usually it's a neck and, around the abdomen, fat around the abdomen.
Because I've lost 60 pounds, but it took over 2 years.
Yeah, I think you're endocrinologist in the right track. So adrenal, it may be the gland which is responsible for what your symptoms, and he's doing necessary tests.
Jane?
What do you do for overactive adrenal gland?
Oh, it depends. If it's tumor that produces glands, you might have a surgery to remove it. And it could be different reasons, but I think this will be probably like most common reason.
Oh, really?
Mm-hmm.
Jane, by the time we come back for season 11, I hope this is all worked out and you have good news for us.
I'm ready to offer a bounty to the doctor, whoever can find it.
But Jane, so anyway, what are you going to do when the show's off the air on Tuesday nights? You're not sure?
I don't know.
Well, we're going to show reruns, so I don't want anyone going over to American Idol. You watch the reruns, okay?
I know you're on 10 o'clock in the morning also.
And we're on 3 in the morning too for those who have a little insomnia, okay?
Okay, have a good night.
Take care, Jane. Good to see you.
Okay.
Now, there's a rumor, I'm not sure if this is true, that Eileen may have the quiz. So hold your tickets at home. Eileen, try and call us back so we know you're okay. Sometimes the excitement, Dr. Brennan, causes arrhythmias and you don't know what's going to happen. We're now going to go to Rose. Hi, Rose.
Hi, doctor.
What do you think happened to Eileen?
I don't know what happened.
I know, okay. Eileen, if you're there, call us back. Well, Rose, where are you calling us from?
I'm calling from Rockaway, doctor.
Oh, there's not much restaurants out in Rockaway,
No, not in Rockaway.
You can catch a fish maybe, but that's it.
Yes, you can catch a fish, correct.
Yeah. What can we do for you tonight?
Doctor, I have on this left breast, I had like a gland and it was like swollen, and I went to my primary doctor. He gave me some antibiotics and it went down, but I went to my gynecologist and he says that it's like a cyst. So they want me to see a surgeon.
Oh, let's ask Dr. Douglas about this. There's a cyst of some type on the breast. It's gone down, but they wanted to see a surgeon.
Yes. Rose, is that a cyst of the skin? I mean, inside of the skin or inside the breast itself?
It's inside the breast.
Okay, yes. If you have a cyst, did they try to aspirate it?
Okay.
I mean, that's one of the things the surgeon can do, or the primary care physician. But
did they stick a needle in it, Rose?
No, they didn't do a biopsy still.
Okay.
So how old are you, Rose?
I'm 49 years old.
49 years old. So yes, I think it's reasonable to see a surgeon, or they could put a needle in it, or they may have to. Are you still having your period?
No, doctor.
You stop having your period. So
no,
yes, I think that's a reasonable thing to do.
I actually did a hysterectomy.
Yes, a reasonable thing to do, to aspirate it or to remove it. Yes.
Okay, doctor.
Rose, thanks a lot. Have a great off season, and we'll see you in the spring.
You too. Thank you, doctor.
Take care. We're now going to go to Joseph, who's waiting patiently. Hi, Joseph.
Yes.
Joseph, how are you? Where are you calling us from?
Howard Beach.
Howard Beach. You make it a little louder. I understand Russo's on the Bay opened up another little catering place or restaurant.
Well, I wouldn't know. I don't go out to eat much.
Oh, there's a good place out there. Russo's on the Bay.
Mm-hmm.
Frank Russo.
I've heard it.
Excellent for parties and stuff like that. So, but what can we do for you?
Well, I just had 4 stents put in about 7 or 8 months ago.
How old are you?
55.
Okay, so you're 55. Okay. I want to ask Dr. Brennan to take over again, maybe ask you some questions. Why 55 and has 4 stents?
Let's hear the rest of the question, and then we'll.
Well, I'm wondering what determines the factor between having a balloon or a stent.
Okay. I think first of all, Dr. Garner was wondering why you started with your heart disease so early, and it is indeed what we call premature atherosclerosis, when it afflicts men before age 55 and women before age 65.
I'm just going to ask Joseph, I want you to listen to the answer because I'm getting the sound of the sea in the background there, and I'm just going to, so you listen. Okay.
That's usually related to having extremely high levels of cholesterol or another genetic predisposition, and I'm not sure what is the case for you. Many people who smoke and have very high blood pressure also can be at risk of having coronary disease early on. As far as the technical question, what's the difference between the balloon and the stent is really a metal scaffold. It's a mesh that's actually crimped on a balloon in order to be deployed, and when the balloon expands, the stent expands with it and sticks to the vessel wall. Then we deflate the balloon and we take it out, and the stent stays inside. The advantage of putting the stent compared to just opening the blockage with the balloon is that the chances of re-narrowing are much smaller. In fact, they are cut in half.
Dr. Brennan, can I ask you, does that mean that everyone who gets an angioplasty should have a stent put in?
Pretty much so. Today in the United States, about 90 to 92% of all procedures end up with a stent, and the other 8 to 10% don't get a stent, usually because the vessels are too small for a stent to be fitted in. And so for practical purposes, yes, the vast majority of patients.
Thank you. And now we're going to go to Larry, who's on line 4, before we go to a break. Hi, Larry.
Hi, Dr. Garner. How are you?
Oh, is this Larry from Rockland County?
Yes.
One of our most loyal listeners calls from Rockland County, where you can't get it on the TV yet, but listens on the computer, watches on the computer.
Yes.
So, what can we do for you tonight?
I wanted to ask Dr. Sapanya a question.
Okay, what's the question?
I'm a diabetic, and recently my glucose levels have been getting a little strange. I wanted to ask her if the injection sites, one, what are the best injection sites? And two, do the injection sites make really a difference?
What kind of injections we're talking about? Is it insulin?
Injections.
And
yes.
What insulin? Is it?
The glargine.
Oh, okay. So this is not regular insulin.
I also take regular insulin. I would take Novolog.
And okay, this is very important, to differentiate between normal insulin, as people say, and that another type of insulin injection. It's not even insulin. It's different type of medication that helps for diabetes. And when you're saying that your sugar behaving not normally, what we are talking about? Is it like low blood sugar?
It's elevated.
It's elevated?
Yes.
So it was normal and now it's elevated?
Right, and when I check my blood during the night, it can show, a normal range, 125, and in the morning I'll wake up, it's 220.
Okay.
Is that a condition where you get the Samoji effect, where you get a spike?
I'm not sure if it's the type of insulin he's taking, it may be connected to this, effect. You take in Novolog, how many times a day? Is it?
I take it for 3 times a day, Novolog, and I take the Lantus once. I was taking it at the night, and then I changed it to the morning.
I think that you would need to see the doctor and maybe to change the dose of regular insulin, especially the dose of insulin at night. Sometimes you take a lot of insulin for you and your sugar.
I take 8 units of the Lantus.
So, for example, you take 8 units and it's a lot for you. And 2 hours, 3 hours, your sugar comes to 60 and even below, and you don't check your sugar at that time, you don't know that it's low. But in fact, your body feels like, we are out of energy. We need to bring some sugar, so your liver start to produce, enough glucose. That's why in the morning, your liver produce enough glucose because initially 2 hours after your injections of Novolog, it was really low. I think that this is probably the most common reason why it may happen, and in fact it was described as a Samoji effect, and I think your endocrinologist will adjust your dose of Novolog.
But I got to move on, Larry, because Eileen, we've located Eileen.
Okay, then I won't give you the word. I'll let Eileen give you the word.
That's a chivalry. Chivalry's not dead.
Okay. Thank you very much, Doctor.
We'll see you in the spring.
Right. Look forward to it.
Take care. We're now going to go to Eileen, who we've located. Eileen? Yeah, are you there? Eileen, we're going to come back from the break. I'm going to put you on hold. And when we come back, we're going to go right to you. So,
I'm here, doctor.
Okay, can you hear me?
There's nobody here.
Yeah, I think she's got the problem with the phone.
That's,
Eileen, can you hear us?
That's me.
Are you watching the TV?
No.
Okay, because there's a little delay. We understand you might have the answer. I'm not sure. But hang on. Let me get a drum roll before you give it to us. Can I have the drum roll, please?
Drum roll.
You like that?
Yes, very much.
Thanks. We didn't have that before. Anyway, getting back to the suspense. What do you think it is?
Headache.
Headache. Absolutely correct. Absolutely correct. Now, what made you get it?
I don't know. It just came into my head. I'm 87 today. So.
No, 87, and it's a birthday?
Yep.
You got a great prize coming your way. I know they're getting to work on that plaque right away. You haven't won before, have you?
Yes, I did once.
So you have the plaque already?
Yes.
Where is it hanging?
In my bedroom.
Very good. So now you're going to have two. It's going to get crowded in there.
Yeah, now I'll have partners.
But Eileen, was so happy and great to hear about your birthday. Where are you calling us from?
Bensonhurst.
Oh, great neighborhood. My mother came from that neighborhood.
Oh.
Yeah. What do you like to, do you go out to eat much?
Spumoni Gardens.
Oh, it's the best ices too, right?
Yes.
Anybody here know Spumoni Gardens? What a great place. Outdoors, you can sit in the summertime out there. L&B Spumoni Gardens. If you ever get to, where's that, somewhere?
It's in 86th and Stillwell, I think.
Excellent, excellent. So Eileen, what'd you do for your birthday?
Nothing. I'm kind of old.
No, but you sound great. And this is you made it memorable for us, and we're going to work on your plaque and send it out to you.
Oh, thank you. And you're a program. I can't wait every week to hear it.
We'll see you in the spring. We're going to be taking a little break and come back in the spring.
All right. I'll miss you.
Okay. Take care.
Okay.
Well, I'm all out of breath from this excitement, but I'm going to have to take a short break. Now, I'm going to give you a special prize, actually. There's another word that begins with H-E and ends with H-E. It's not headache. If anybody comes up with that, we're going to have a double winner for our last show. Okay, so it's another word that begins with H-E and ends with H-E. All right, so we're going to continue to talk about internal medicine, family medicine, heart disease. Again, our phone number is 499-6101. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. Well, welcome back to Ask the Doctor, where we just had that exciting moment with Eileen. And now we're going to continue with our topics of internal medicine, family medicine, and heart disease. And I've been told I go straight to Ruth. So let's go right to Ruth. Hi, Ruth.
Hello, doctor.
Thanks for waiting patiently.
Yeah, thanks so much, doctor. I have been waiting to talk to you.
Where are you calling from?
I'm calling from Woodside, Queens.
Oh, very nice. That's near, Woodside is out, where is that? Woodhaven Boulevard?
In Queens, in Northern Boulevard.
Right.
Yeah.
A lot of car dealers around there.
Yeah, but we live in the residential section.
Very nice. And what do you like to eat when you go out in Woodside?
Pardon, doctor?
Which is your favorite restaurant in Woodside?
There are Chinese restaurants, and there's also an Italian restaurant.
Which one is the Italian?
I don't know. Il Amici, something like
Il
that.
Amici.
Yeah, something.
Anybody speak Italian here? That means a friend?
The friends.
The friends.
I speak a little Italian.
Ah, very nice. What can we do for you? Oh, Poco.
Doctor?
Yes.
Yeah, my question is about my knee.
Okay.
Yeah, my right knee, and my left knee already is starting to shake, and I would like to know why it's shaking. First, it started as
It shakes. Let me just ask: when you stand up, it shakes, or when
yeah,
you sit?
when I stand up, it's shaking. But when I sit down lately, it's starting to shake too.
Okay, just the knees. No other part of the body?
Just my knee, but when I wash my hands, like my hands also start to shake.
Okay, how old are you?
I am 48.
Are you taking any medicine?
No,
So let's
except
get
for
right to
glucosamine.
let's get to Dr. Douglas and see if he can make heads and tails of the shaking.
Yeah, and my heart is also like palpitating.
Mhm.
I think it's because of the knee, and you know, like I feel like a constriction in my knee.
Yes. Do you feel anxious also, Ruth, when you
Well,
have?
I feel anxious because of my knee. You know, like my heart starts beating when, you know, my knees are shaking.
Yes, yes, yes. The first thing I would say that is that it sounds like anxiety, actually. That the heart racing, the shaking of the knee, that's what it sounds like to me, actually. Because at 48, it's unlikely that you're going to get the most common other thing that causes the shakes. Which
Yeah, but how come, doctor, I'm shaking and it's not improving? I wasn't like this before. Like I experienced difficulties in life, but I wasn't shaking.
Yes, well, I'm really sorry to hear that, Ruth, that you're having this problem. You know, would you consider seeing a doctor regarding the possibility of anxiety?
I went to the neurologist. The neurologist said there's nothing wrong.
Well, I always think, as Dr. Garner said, you know, the first step is to really see your primary care physician.
Pardon, doctor?
The first step should always be to see your primary care physician.
Yeah, I went to the primary care, and she said that there's nothing wrong, but the shaking is getting worse.
Yes, yes, yes. Is there anything bothering you other than that? Anything going on in your life then that could be also a significant problem at this time?
Not really. I'm okay, but you know, my knees are shaking, and then there's a constriction in my knee, and then, you know, like when I stand up, you know, like I feel like something is pushing it back.
Yes.
And then, you know, like lately, like this afternoon, like I feel like it's not just a shaking, but like there's a sensation of a bubbling
Yes.
in the knee.
Yes.
You know?
You know,
Yes.
Ruth, as Dr. Douglas said, the mind can sometimes play tricks with us and can cause symptoms. You can be depressed. It can cause pains and aches. Before we say that's what it is, though, I think it's important to get a second opinion. So we have Dr. Douglas's number across the screen if you want to get a second opinion to see him as a patient, or if you need a referral, then we can refer you to somebody who can.
So what doctor could I go to?
Well, why don't you call us after the show? You can either Dr. Douglas's number is there, his office, if you need to make an
But
appointment.
doctor, it's not multiple sclerosis or hyperthyroidism.
Dr. Douglas doesn't think so. He thinks that it's going to have a happy ending.
How come I have like rapid palpitations in my heart?
I mean, there's a component of anxiety, it sounds like, and I would really like you to see one of the family doctors.
Okay, family doctor?
Yeah,
Yes.
and you're gonna look on the screen and you're gonna see Dr. Douglas's number, or you
Okay.
can see my number, and we'll give you a referral either to Dr. Douglas or to another family doctor.
Okay.
Okay,
Okay, doctor.
Ruth,
Thank you so much, doctor.
You're welcome, Ruth.
Feel better.
Bye-bye.
Let's go right now to Sandy. Hi, Sandy.
How you doing?
Very good. Where are you calling us from?
I'm calling you from Midwood.
Oh, the Midwood area. Plenty of good restaurants in the Midwood area, right?
I got to live near you.
Avenue U, what, the 3-star?
You better believe it.
Yeah, it's a great place. You see this? I love that place. What's his name? Jimmy and not Jimmy. Yeah, Jimmy.
That's Jimmy, right?
Yeah. That place serves the freshest food. It's
And
like
the
a
best
diner.
breakfast.
The swordfish?
The best breakfast.
Breakfast is excellent. So anyone around Avenue U and East 15th Street, I recommend that place. Jimmy and George, I think, are the two
That's right.
people. But what can we do for you now? You have a medical issue?
I have a question.
Yes.
I was very lucky. 20 years ago, I had surgery. I had an excellent hospital, excellent doctors. I had my lung cancer in my right lung.
Okay.
And I'm still here, and no complaints. My question is, I had vertigo, so they right away sent me for a MRI on my brain because they thought that, God forbid, the cancer had traveled over the 20 years.
Yes.
And I've had other MRIs for different things. I've had CAT scans for different things, X-rays, etc. If I've had cancer and I start getting all these X-rays and different things, would that bring a cancer about if it is hiding someplace?
Well, let me just start with that. I'm going to turn it over. From the X-ray standpoint, you mentioned MRIs, which don't have any radiation. Ultrasound doesn't have radiation. The CAT scans are perfectly reasonable if you're looking for cancer recurrence. It's not going to cause a recurrence of cancer. What we always stress is not to get unnecessary X-rays. These are definitely necessary X-rays because your doctors wanted to know what was going on. And this way they get a look into the body without having to make any cuts or any surgery. So it's very important to get all these X-rays and not to worry about it, okay? It's when we worry when large groups of people get X-rays that they don't really need. that you start seeing these cancers crop up in very few people, but it's a definite number. When it comes time to an individual like yourself, it's not going to cause you to get cancer. So you should feel well about that. But what about vertigo? Anybody want, Dr. Saponia, vertigo?
That's a recent thing.
Right.
I think if you did MRI and didn't show any lesions connected to your possible recurrence of your disease, that this is probably some benign positional vertigo, which is like very common reason of dizziness in your age. And if you would see the doctor, it may be very simple maneuvers they can do on you, with the movements of your head to release it, or in fact they can they can look for another reasons why you might be dizzy. But it's very good that it's not related to your basic disease.
And we're kind of amazed. 20, how long ago was the original cancer?
20 years ago.
20 years. And she's still here. And
Yeah.
were you a smoker?
Yes, I was. I had stopped 5 years before.
Amazing. Very lucky.
And I had excellent doctors and excellent hospitalization there.
Well, it's good news. We're glad that it happened. Don't worry about the x-rays. It's fine. Okay?
I thank you very much.
Take care. Let's go to Valerie now. Hi, Valerie.
Hello.
Hi, Valerie. How old are you?
I'm 33.
33. You have a nice voice, a very young-sounding voice.
Oh, thank you.
Where are you calling us from?
I'm calling you from Brooklyn Park Slope.
Park Slope, not far from very close by. What do you like to eat in Park Slope?
I really don't eat anything in Park Slope.
Oh, yeah, it's like a rule that you have?
I always go to the city.
Oh, me too. Very good. Which one do you like in the city?
Well, there's so many restaurants I love in the city.
Yeah.
I love the Village a lot.
Yeah, some really nice places in the Village. A little romantic, little small restaurant, right? A little candlelight.
Yes, I do. I love the Village.
Very good. What can we do for you?
Well, I'm here. I'm calling because I have very concerned. I took in the flu shot in September. And from the flu shot, I became very ill from the flu shot. And
Are you feeling well now?
Huh?
Are you feeling okay now?
No, the doctor put me out of work for the next couple of weeks because I'm not able to walk well. I have a whole bunch of vertical dizziness that keep me constantly falling down. My bones are weak. I have pains in each part of my body that has its own pain.
And you never had this before you got the flu shot?
I was a healthy girl. I jogged every weekend in the park. I had a great life until now. If you look at me now, you could tell that I'm suffering. I'm walking with canes now because of it. I'm not able to see well. I'm constantly have burning needles in my face. I can't use my hands.
Let me ask. I think we'll get a picture now of somebody who's getting debilitated with all kinds of problems. That was a vibrant, healthy person, got a flu shot. Whether coincidence or not, now is left with this. I'll start with Dr. Douglas. Then I want to go to Dr. Brenner on this.
Yes, I'm really sorry that you have all these problems. How long have these been going on?
Since September of '09.
Okay, so it's been 6 months then. Yeah. It doesn't sound like it's from the flu shot, actually. Although I know that's what you think, then they may have said that, but it sounds like a conglomeration of a number of things going on at the same time. What are some of the things that the doctors have felt that it might be?
They don't know.
They don't know.
They have no idea because when I took the flu shot, when I was injected with the flu shot, I immediately passed out from the flu shot right instantly after I was injected with it. And from then, I have been receiving a lot of rashes, blue and black rashes throughout my body, blisters throughout my body.
It's a tough one. I mean, it's not an easy question. There's some syndromes that it sound like it could fit into maybe like a chronic fatigue type syndrome. Are you a little depressed?
No, I'm not.
Good.
I was a happy woman.
Now.
Well, who wouldn't be?
Yeah, it's a good point. It's a good point.
I'm suffering from pain.
Absolutely.
I'm suffering from headaches, vertical dizziness. My bones are weak.
Have the blood test shown anything in particular?
The blood test doesn't show anything at all.
Okay.
I mean, I don't know if the doctor's taking the right tests. I'm not sure. For what they're taking, everything seems to be fine. So they don't know why I'm suffering this way.
Dr. Brenner, do you?
Have you seen a neurologist?
I'm seeing a neurologist now, and he still can't. He do believe that it came from the flu shot.
Did they do a lumbar puncture where they stick a needle in your back and check the fluid?
No.
No. Yeah.
I have to write that down.
I mean, we certain things come to mind where it goes on with multiple aches and pains and strange symptoms along going with depression, and more common in female. They come under different names: chronic fatigue syndrome or fibromyalgia. Has anybody mentioned these to you?
No, fibromyalgia has been mentioned. They may think that it probably all came from due to the flu shot.
But the point is, whatever it is, if we know what it, whether it came from whatever, we have to deal with the situation now to make you better.
Exactly.
Right, that's the problem that I'm saying to happen. Nobody's not coming up with no diagnosis. I'm still suffering. I'm home from work, and it's terrible.
Have you seen a rheumatologist?
Yes, I have.
Because they have the most experience at treating that condition.
Right. Yeah.
I would definitely, we're going to try and give you a referral because you're sounding, it sounds like you're at wit's end. You really don't know where to turn.
Yeah, I'm stuck right now, and I'm seeing doctors after doctors running around, and nobody cannot pinpoint it. Everybody is saying this is unreal. We never heard of this, and but meanwhile, I'm suffering.
So what we're going to do is,
I'm a 33-year-old woman who been very active, jogging, very fit, never had any problems. Didn't go to the doctor until I took the flu shot, and now I'm having all these problems.
So what we're going to do is, you have our numbers up there, and if you call after, we're going to give you a referral to a doctor who we think can specialize, especially help you. Okay? So don't despair. We're going to work on that, okay?
Okay.
Okay, call us back after the show.
Okay, at the number that you have on
Yes.
television?
Yes.
Okay.
Take care.
I can do that. Thank you.
Okay, bye. It's tough. You have a lot of problems. Okay. Janet.
Yes, how are you, doctor?
How you doing? Where are you calling us from?
Bensonhurst.
Again? Or you didn't call again, did you?
No, but I've won before.
That's okay. There's no rule. We don't have that rule yet.
Okay. I thought you were going to take my plaque away.
No. We'll send the patrol over. But can you just withstand one more drum roll because it's too much.
Oh, okay.
One more drum roll.
Oh, okay, fine. Thank you.
What'd you think of that?
I think it's beautiful.
Thank you. So, now we had a word that begins with HE and ends with HE, and we had one answer as headache. You apparently have another answer.
It's heartache.
Heartache is correct.
But Eileen made it very easy for me.
Eileen, yeah, she's 87. Not your birthday, is it today?
No.
When is your birthday?
September. I'll be 72.
Wow, sound great.
Thank you.
It's coming up on your half birthday.
That's it.
Yeah.
I'm half.
Half a birthday. So
but I have to say that I love your program. Very informative, and I never miss it.
Very good. You're going to watch we're going to be on again now in May 4th. So
right.
You can watch reruns, though, up until then, and then we'll see you live.
Oh, great. Excellent.
All right, so we'll be getting your plaque out to you very soon.
Thank you so much. I'll have matching pairs now.
Yeah, which room do you keep it in, if you don't mind?
I have it as soon as you walk in the foyer, and people always ask. It's
very
a conversational piece.
Conversation. All right.
I have a question, though.
Oh.
My husband's diabetic.
Uh-huh.
And he also has a heart. He's had 4 stents. He runs the gamut. But now he's been on a very strict diet, watching his food, losing some weight. The stomach. Now, I read somewhere that there's a correlation between stomach and diabetes, but he can't seem to get rid of that stomach, and he goes to cardiometric exercise 3 times a week. What can he do for that?
I'm going to start with Dr. Brennan. We're going to work our way down this way. The number of stents that he's got, and he can't get rid of his stomach.
I presume you mean to say that the stomach continues to be bloated despite the fact that he lost fat. So we think that many patients who've had diabetes for a long time suffer from denervation or abnormal nerve impulses in the stomach that cause it to malfunction and not to empty properly. So it's not really fat, it's just a matter of not properly emptying. And in fact, there are a number of interventions that can help with that, medications. It's probably not a good idea to do it over the airways, but rather to discuss with your doctor, just because different patients should be given different of those medications.
Oh, okay.
But there are certainly treatments for that.
Oh, all right, because he's getting very discouraged.
No, she shouldn't.
Yeah, because he's working so hard at
right. No, he
staying
should
on
continue
track.
to work hard, and we can help with that.
Okay, thank you so much, Doctor.
Okay.
I appreciate your
Be
help.
well. Be well. There's one study I just want to bring up. Actually, many women and men take aspirin, the 81 milligrams, to prevent heart or strokes. And a study that came out tonight, actually going to be a big story tomorrow, is that it also seems to prevent recurrence of breast cancer. Women who are taking one aspirin, the 81 milligram aspirin a day, had a much less incidence of recurrence of breast cancer. So the study was almost going as far as to say to take it if you've had the breast cancer. It's something to talk to your doctors about. Obviously not to take when you're getting chemotherapy, but when you're done with chemotherapy, to take one aspirin a day. And again, it seems to be like a miracle drug, these baby aspirin. You guys all have your patients on aspirin?
Yeah, definitely. And it's not only like a thinning of the blood, which can be preventing heart attack and strokes, but it's anti-inflammatory medication and decreases all the free radicals. And I think this is probably etiology, behind help people with the breast cancer. So I'm sure that they will find that it's not only breast cancer patients will benefit from it, but all other diseases that in cause of that diseases, it's some free radicals and inflammatory processes in the body.
Interesting. Thank you. Let's go now to Rosemarie. Hi, Rosemarie.
Hi, how are you?
We haven't heard from you for a while.
I know. Well, I got my plaque.
You got the plaque.
Oh, I love it. I'm so happy.
That Linda Lapatosa, she works very hard on those plaques.
Well, she did a great job. I'm very proud of it. And I knew one of the answers tonight.
But you couldn't get in.
No, but I couldn't call again. How many plaques am I going to? That's not fair.
No.
Me. I just keep on getting plaques and plaques.
Yeah, then you got to go see a dentist. No, okay. How do you say it? I'm sorry.
Oh, you're very funny. Anyway, I wanted to just say one thing. I saw you on Fox News the other day. You were talking about the MS pill or something about that.
Right.
There he is. You're everywhere.
Oh,
you're great.
What do you think? They do better? They do better makeup at Fox or here? Can't tell.
I think maybe Fox.
Yeah, I think so. All right.
Anyway, my question is for the heart man regarding my uncle who has a defibrillator, and he is going to have his batteries changed, or I was wondering, do they take the whole defibrillator out, or how do they work that?
Luckily, no, they don't take the whole defibrillator out. Rather, a small incision is made where the generator, that little hard circle is under the shoulder bone, usually on the left side, and the generator only is taken out. It's disconnected from the wires that go into the heart, and then a new generator is connected, tested to make sure that it properly does what it's supposed to do, and then the wound is sutured back and with a little dressing till the next morning, and that's the end of the story.
Oh, very good story.
Yeah.
Oh, thank you very much.
Nothing to be concerned about.
Oh, thank you so much, and have a wonderful. Well, we'll see you in the spring. You said.
We'll see you in the spring. Just stay safe, and
we'll miss you.
We'll miss you too. Thanks,
okay,
Rosemary.
Take
care. Bye. The last caller of the 10th season finale is going to be Helena. Hi, Helena.
Hello, Doc.
Is that the way you pronounce it, Helena or Helena?
E-L-E-N-A. No, the H is silent. Elena.
Elena. No way. I like that. What's the derivation of that name?
Well, Helen is a Spanish name.
Beautiful name, Elena.
Yes, means Helen in English.
Yes. Huh.
Yes, Dr. Gordon?
Yes, what can we do for you?
Yes, last July I had a cardiac catheterization, and everything was negative. But 2 weeks ago now, I came out of the hospital, and now there's a chest discomfort, and I don't know what is happening. I'm going to see my cardiologist on Thursday.
I missed exactly. Are you having chest pain?
Chest pains on my two arms and on my left side.
I want Dr. Brennan to address that because we don't have much time. But is it possible she comes out with a negative catheterization and has chest pain due to heart problems?
It is very unlikely. Like every test that we do, there is always the chance that the test was inaccurate or not interpreted properly, but it would be very, very unlikely that there is anything significant going on in your heart, or at least in the arteries of your heart. You should remember, though, that many other things can cause chest discomfort besides blockages. and the catheterization only detects those. It cannot detect other things. And so there are about 5 or 6 important other structures in the chest that can hurt. And so,
Example, Doc?
I'm sorry?
Example, you said at least.
So, for example, a good example is the esophagus, which lies very close to the heart, and spasm of the esophagus can seem exactly like a heart attack, and many times we are fooled by it. The chest wall itself is made of muscles and tissues that can actually hurt, particularly when they are inflamed. The lining of the lungs that sits just in front of the heart can hurt as well. And so there are many possibilities for mischief, and we just need to find which one it is.
Eleanor, so it sounds good. Hopefully it's not the heart.
One moment now. But when I came out of the hospital 2 weeks ago, they said I had a spasm. I'm hemiplegic from a stroke of 7 years. But I thought I had another stroke. But my blood pressure was very low yesterday. It was 160/90.
That's not very low.
I mean, very high.
Yes, it's not terribly high, but it shouldn't be like that. You should be much lower than that.
But Eleanor, we're moving on now, but it sounds like you're in good hands, okay?
I'm going to see the cardiologist on Thursday.
You're going to call us back in the spring. I'm sure you're going to tell us everything is okay.
Okay, thanks.
Okay, take care. What about spasm? I think I'm forbidden to take any more calls. I'm sorry. I know we have a lot of calls left, but this is the last show. We've got to sign off. Can you give me a quick word of advice in general? How do you stay healthy?
Diet and just probably good spirit.
Good spirit, Monty?
Get adequate sleep, exercise regularly, don't smoke, don't drink, and manage stress properly.
Dr. Brenner, your 2 words, key to staying healthy from a cardiologist.
I'd like the spirits thing.
You like the spirits and the alcohol. No, okay. Well, now we're going to say that's it for this edition of Ask the Doctor. I want to thank Dr. Anna Saponia, Dr. Montgomery Douglas, and Dr. Soren Brenner for coming in, and we hope we were able to help you. It's good to remember that you should be proactive about your own health. Speak to your doctors about your concerns and go for second or third opinions. In the meantime, continue to watch NET and visit the website at netny.net/askthedoctor. Here you can check out past quizzes, submit your thoughts on the forum, or just watch past episodes. For those who like to tweet, follow us at twitter.com as netnewyork. I want to thank you for all your calls tonight and for all the calls this season. I would also like to thank Linda Lapatosa for the excellent quizzes. And I want you to know that we're going to see you again in the spring, so goodbye, stay healthy, see you in the tablet.